Welcome to the PoshCast. We have not been on in a really long time because we're moms and our life is completely unpredictable, but we will do our best to be back on air every month. And every week you can check out a new episode. Today I've got Zenga, a longtime friend who knows way too much about me, so you can never leave me. I'll find you. And she also is a makeup influencer and a mama of two. And you've been in the club for quite some years now from Boston. Yeah. And then we've got the amazing Dr. Allison Yee.
Hello.
Thank you so much for coming. I know you're super busy, but we're so happy you're here.
Anything that's empowering women, moms.
Absolutely. Well, thanks for your time.
Of course.
So where do we begin?
Yeah,
We've got so many questions.
We have a lot of questions for you.
Sure.
So first of all, where'd you grow up?
I was born in Santa Monica, California.
No kidding.
Mm-hmm.
Okay.
But it was great. But I think I was in fourth grade. We moved to Indiana in the 80s. So my mom was not so happy moving from LA
I don't blame
to
her.
a cornfield.
I wouldn't either.
Right. And yeah, my dad, he did it for a great position with his job. But my mom was like, wow, you moved me to a cornfield. That's
I can't
great.
even imagine. That's a lot.
Very
Are
much.
you
I have a sister.
You have a sister?
Yeah,
So
she's 3 years older.
Oh my gosh.
So-
The whole family's like uprooting from Santa Monica.
To a
Dream.
cornfield. Okay. Yep. But honestly, now Indianapolis, the Carmel area, it has changed so much. It's wonderful. They're still there. Like they don't want
wow.
to leave. They're thinking, oh, well, are we going to get a place in Naples and come down? And they're like, no, we love Carmel.
Well, they probably hear all the hurricanes too. That they're
Well,
like,
that
that's
is true.
not who. Yeah, that's
That is
turn
true.
off.
But so I consider myself a Hoosier. So I grew up in Indianapolis. I went to undergrad and did medical school at Indiana University, and I stayed. I did my internship, residency, and fellowship there.
Oh, wow.
And then when I was done with my fellowship, I moved straight down to Fort Myers.
Did you always know you wanted to be in this field?
No.
No. What did you want to be?
So
Well, you went to medical school, so you
Yes.
knew you wanted to be a physician. Of some
I'm a
sort.
fourth generation.
Oh
surgeon.
goodness!
Wow.
But but I grew up, no pressure from my parents to do that, and my mom's an artist. My dad is a neuro-ophthalmologist.
Wow.
He's like weird smart. But I loved art. So actually, when I graduated high school, I'm like, I'm never taking another math or science class ever again. And so I majored in fine arts and art history. And after which I finished, but I was like, I'm not gonna be able to make a living with this. I'm not the best artist, and I don't want to be a teacher. So I'm like, yes, of course, I'm good at math and science. So I did the biology as well, pre-med. And actually shocked my parents when I told them. They were like, oh, okay, great. So did the fine arts and art history, but also biology pre-med stuff. And then, of course, when you're doing your medical, in medical school, you then decide what you want to do. So I tried to do everything other than not what my dad did.
Of course.
Because I never wanted to compare myself to him. But I kept going into different specialties. I was like, oh, anesthesia, that's cool. But then I'd be in there and I'd be watching the surgeons, wanting to do that.
And that's what you grew up around.
And so
That's unbelievable.
I decided to do ophthalmology. And I did my internship and then residency all at Indiana University. My dad was actually a chairman of the medical department there. But then I decided, okay, well, I want to do plastics. So then I did fellowships in oculofacial plastics with a lot of trauma and reconstruction, and then additional training in the fun, pretty stuff.
Aesthetic stuff.
Yes. So it's sort of you work your way out and then learn a bunch of different things. You have to be able to see it three-dimensionally, and every surgery is different for everybody's face. Even from one side to the other, you have to change and fine-tune things.
Have you been doing facial plastic surgery in Florida? That's where you started and that's where you've been. Your age demographics have ranged from, has it been mostly older because of Naples?
It is. I'll be honest, it's all over the board.
Okay.
I mean,
Okay.
I for a very long time did a lot of trauma reconstructive. For years, I was the only person in Southwest Florida who took Sunshine Health, like so any kind of kids on
No kidding.
Medicaid. Like I was the only person who saw them. I don't do as much of the peds and trauma things now, but it ranges. I mean, I do surgery on teenagers all the way up until I think my oldest surgical patient was like 87.
Oh.
So I mean, and I'll do small things, if they're older, obviously if it's safe. But yeah, it's a huge demographic.
Who was the celebrity that passed away doing surgery that I love? She did Fashion Police.
Joan
Joan
Rivers.
What in the world happened there? What was she getting done? Does anyone know?
I don't know. I heard that it was something ENT related, either nose, throat. I don't
That was
know.
awful.
But I mean, she had multiple procedures and she was older.
Yeah.
I mean, as surgeons, that's one of the things you do is you want everything to be safe. So like in surgery, we do our thing, but we have to be conscientious of making sure that the patient's healthy enough to have anesthesia. So you get all those clearances, and I'm sure her surgeons and the anesthesiologist got that, but it's unfortunate because sometimes things can happen.
Yeah.
That leads into, you are board certified plastic surgeon. What is the difference of a board certified plastic surgeon versus, and the reason I say that, I know some of the moms in the club, they'll be like, oh, I'm going to Miami to get done, and then I'll look, and the doctor is not board certified, but he is a surgeon.
Sure.
What is that? What is the difference? What does that mean?
Board certification is important. There's a bunch of different types of board certification.
Okay.
As surgeons, and it's funny, when I was training and I was looking at residence or after fellowship, looking at job opportunities, one of the couple of practices I went and interviewed, they're like, oh, well, do you want to do breast implants? And I said, no, I did not train with that. No, like I'm not going to do something that I'm not an expert in. So there are, if you have an MD, you theoretically can operate, but there are guidelines and there are limitations. There's a ton of limitations as far as safety, as far as if you are performing a procedure in an outpatient surgery center. There are a bunch of different accreditation councils for a surgery center that, and then some are minimal credentialing, and then there's the like Quad A, which our surgery center has, which is very difficult. You have to pass so many different inspections and different levels of safety, which is obviously, yes, a good thing.
But yeah.
So you can have somebody who's, let's say, an internal medicine doctor, and then and it completely depends on where they went to learn the techniques. You want, again,
Let's say Brazil. Let's say Brazil.
So
example.
There are some amazing surgeons in
Absolutely.
Brazil. Who did you train with? How long did you train? And it depends on the procedure. Like liposuction, theoretically, if done safely, it's a very straightforward procedure. But you don't want to go to somebody who's gone to a weekend course and done like a couple.
So could there be a physician who's just an MD, does a weekend course in liposuction, not board certified, and says, I want to start doing lipo tomorrow?
Yes.
I didn't know that.
That yes.
And that scares me because there's these chop houses, is what what they call it.
Absolutely.
And yes, it sounds great. There's all these specials on Instagram, like $3.99 for, tummy talk. Okay. Especially when and here the thing is, there's these poor moms that, they're unhappy with their bodies.
Yeah, I mean, they've gone through I'm sorry, we grow our babies in our body. I love them, but they ruin some things.
Mm-hmm. Everything. Yeah. I mean, everything. Yeah. Mentally, emotionally. I mean, physically, forget about it. So what did I get? Forget about it. What am I from Jersey? I'm hanging off on me. We're not hanging out anymore.
You want to do something, and it's expensive.
Yeah.
And there are, in areas, especially on the east coast of Florida, they're a dime a dozen, and they've got their ATMs in the waiting room.
You've got to be
careful, ladies. Do
please.
Your research.
Yes,
you really
please.
do. Reviews are great. There's really just checking who your surgeon is, and I'm sorry, if it's ridiculously cheap, way out of scope of everybody else, something's wrong.
Something's wrong, yeah.
And also, don't go out of the country and have surgery and then come back, because
they get
if you have a complication, no plastic surgeon is going to touch you.
Yeah. That makes
here
sense.
because then they are
interesting.
medically liable for what that surgeon did.
In another country.
And
yeah.
you have no clue. I have done reconstructive things on the face, and I find things that I'm like, what in the world is that?
That is so scary.
It's, again, you have
So
to be
ladies, look,
cautious.
for me, I think the biggest thing out of this is find someone that is board certified. There is a reason that's on there. It's not a gimmick. It's not a marketing thing. This is a safety thing. And I mean, that is when we got on board with Azul plastic surgery, or Azul cosmetic surgery, medical spa, it was amazing. I mean, this is board certified, well trusted. I mean, you guys have been around
20 plus years.
Exactly. I mean, you guys have multiple locations. So I'm always saying, ladies, there is a reason why we recommend Azul,
Right.
and there's a
Stress
reason.
importance,
And
yeah.
it's the same
Safety.
thing with surgery and also
Safety.
injectables. You see some Groupon where you're seeing Botox for $8 a unit. Like that's
Is
not.
it true they could water it down?
Oh yeah.
I've noticed that before.
Oh,
yeah,
yes.
I've noticed a difference.
How is that safe?
I don't know, but I've noticed a difference between getting it for the less expensive and just
What?
even
It just vanishes way quicker?
vanishes quicker. I didn't even like how they, you explain how you want it, and I don't think they even really know what they're doing. I was like, why are my brows like square? I'm like, I wanted them lifted.
Yeah,
and
and that's the thing. I mean, it's our face, and of course, like Botox, it wears off.
Yeah.
But
Still.
you do something funky, that person has to live with it for 3-4 months.
Yeah, exactly. Yeah.
I've done it where they did it too heavy, and then my eyelids were rolled
I've
through.
heard that.
And I'm like, I don't have hooded
Hooded
eyebrow.
eyelids and all
or
the
eyebrow.
I actually, when I was in medical school, my girlfriends and I, one of my friends who was in my med school class, her mom was going to her friend for Botox. And we're like, ooh, wait, we want to try it.
Absolutely.
So we
Fun.
went to her mom's friend's house. She was an anesthesiologist who
Okay.
didn't really know what she was doing. She would just buy the Botox and do it. So we're like, okay. And she did my forehead. And literally for 4 months, I walked around like, this is
I've had that happen.
horrible. I'm like, is this what it's supposed to be like? This is
It's
awful.
heavy. It was
like,
heavy.
It felt horrible.
I've had that happen to me.
But now I
Not
realize,
recently,
like,
but
obviously that
the
is
past.
not the
Yes.
right way to do it.
What are your thoughts on dentists being able to perform Botox and
So there are a lot of dentists who are very skilled. It's about knowing the facial anatomy and knowing what the product's going to do. So if you have a lot of dentists, they have a really good understanding of the facial anatomy.
Sure.
It's better than a GYN
yeah, true.
or a
Yeah.
podiatrist.
Definitely don't want the same one down there up here.
You know, it's
Colonoscopy.
like
What is it? That's not. That's a procedure.
like a GI, yeah.
Well, the same place.
But I mean, so there are a lot of dentists who do a
Proctologist.
very,
I think that's the word is.
do very, very good job. But then there are a lot that, it's just a good income. It's so about the provider,
Right.
Knowing the anatomy. And if you know the anatomy, you can do anything.
Sure.
Moving it like onto kind of that, being that you're a female plastic surgeon, you walk into somewhere that they don't know that you're Dr. Yee.
Oh, I'm
Do they
Dr. Yee's
mistaking you?
assistant. Oh yeah.
No kidding.
Oh, I mean, this is a male-dominated
I want to hear
field,
this. I want to hear
especially
everything. This is great.
in fellowship. So in fellowship,
And you always were like glammed up. Do you show up glammed up to things?
well, in fellowship, probably not. You know,
Okay,
I mean,
okay.
I
I'm
was
just wondering. I'm trying to do the visual.
I had my kids, and I'll be honest, I did not plan them this way, but I had my son during my internship,
Oh goodness.
and then my daughter during residency. They're 18 months apart.
Incredible that you were able to balance all that.
I mean, I had 4 weeks off with Jackson and 3 weeks off with Addie. Is if I took longer, I'd have to possibly remat.
Right.
So I mean, it was not ideal, but I
You
did
did
it.
it.
But fellowship, I covered 8 hospital systems with, and I was the facial trauma person. I don't know if I can say this, but like I called myself the fracture bitch because all I did
love
was
I love
trauma.
that. Yeah.
But I would go into a different hospital or later night, new people, and they'd always be like, "Oh, are you Dr. Yee's scrub? We've set the room up, da 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 da." And or are you Dr. Yee's nurse? And I'm like, "Oh no, I'm Dr. Yee." And they're like, "Oh."
Unbelievable. Do you think
Wow.
it was based on gender, age, all of the above?
Probably
or-
both, but especially in the trauma world, it's a male-dominated space. So, even if I do combined cases with like ENT and neurosurgery, and again, like it's they always just assumed that I wasn't
Gosh, that is
the
so
surgeon.
cool. That is
So-
so cool.
Maybe it's. I probably didn't take it as being nice. But now I'm like, well, maybe I just looked young. Like, okay. But yeah, no, it is. It's definitely way more male dominated. And I'll be honest, I've always been the only female surgeon in every practice where I've been.
Wow.
Congratulations.
I
know. Congratulations.
Yeah. It was a lot of work, but totally worth it.
Do you think, well, your daughter's probably really young to know
She's
whether,
turning 17 this
do you
week.
know what direction she's going to want to go?
Oh, so it's funny. When they were younger, I'm like, oh, fun. Who's going to be 5th generation? But honestly, I am like, you do not have to do that. My son is actually in college. It's first year at college.
Wow. Oh, congrats. How's he going? How's he doing?
He's good. He's great. It's me. I'm like,
I would be too.
Because he's at FAU in Boca, so it's
That's where
it's
I
not
went.
that
Go
far.
Owls.
Oh, yay!
I love they have they have a great medical school now, and
I know, I did
now our
not know
football team's
that.
a great, like amazing.
Yeah.
We didn't have any of that going on when I went there.
The campus is beautiful,
stunning. Yeah.
It's gorgeous. So
beautiful.
he was thinking of going to Ohio, and of course, when he said he was staying here, I'm like, oh, I'm not going to be upset. That's fine. Like, I'm totally cool with this. Of course, the day he's driving away, I'm like bawling, and he even came home 4 days later.
Boca's not a bad place to come visit. Go visit and stuff. It's great there.
Yeah. So,
beaches right
but of
there.
course, like every time he comes back and then he leaves again. Like he came back this weekend and then he left, and I'm like,
get those feelings all over again.
I can't imagine.
It's crazy to see. I mean, I look back and he was just my little baby. He was, a little toddler with curly. Both my kids. I'm half Chinese, half Scottish. Both my kids are blonde and blue-eyed. I know.
Wow.
I thought that was going to happen on my end. It didn't. She came out straight Puerto Rican, and like her dad is, not. So it just didn't happen. So
when they came out, I'm like, oh, well, I'm glad I birthed them and saw like that because they were towheads with like
so neat.
Blonde or like bright green eyes.
But you're Scottish,
but they have
so
like
it
my
must
skin
have.
tone.
That strong genes came
That is
through.
so neat. I miss
Now,
kids.
does your son want to get in the same industry?
No,
not at all.
No. I mean, who knows? Because again, my freshman year, I was like, I'm doing art, and I changed. But he's doing engineering.
That's for him. That's amazing.
I'm like, you do what makes you.
They have a great engineering program.
Not just happy, but also like happy, but you can have a job.
Yeah.
I remember going around an engineering campus. I think I was like scouting for a husband, but I was like only 20, because I was in college. But I was like, this is where all the nerds are. I love the nerds. And I would be around the science and the engineering department.
In high school, it's like, oh, nerds, whatever.
Oh, I've always
like
liked
later
nerds.
in life,
Yeah.
you realize like you want the ones who don't peak in high school.
Oh, yeah.
You want the ones who are like
Nerds run the world.
Okay.
They run the world. And my dad was a nerd, and he, I saw the way my mom, they have such a great relationship. I'm like, I want that, and that's just the way it's been.
Oh yeah, my dad's super. I was a nerd. I'm like,
well,
that's
yeah,
cool.
of course, yeah, absolutely.
So
Numbers and science are so
nerds
cool.
Are great.
Yeah,
that's awesome.
That
That was not on the list.
No.
We went off topic. Well, okay.
When it comes to facial surgeries, what are the most common requests that you're getting right now?
I'm doing a lot of laser resurfacing. So, okay, when you say laser, there's like a billion kinds.
Sure.
So I always say there's two main categories. There's ablative lasers and non-ablative lasers. Ablative lasers are the ones that, we do as MDs, where it treats, it's basically vaporizing the skin.
No kidding.
And then you have new skin. That's like the CO2 and erbium lasers.
So you're down after that.
Oh, yeah.
For how long?
Oh,
are you like?
You look like a burn victim right now.
That's what I was gonna say.
Ooh, for how long?
You're pretty. It's pretty rough for the first week.
Wow.
But the second week, it's still. You're having to moisture like Vaseline's everywhere. But the results you get from doing an aggressive laser, you will never get that because the non-ablative lasers don't burn the superficial.
What is the name
skin.
of those machines?
Oh gosh. Anything and everything. They range from the BBL, or IPL, that they use different wavelengths of light to target reds and browns. So that's what you do when you've got like little broken blood vessels or dark spots.
So this isn't
There's
like
like
go
no
in there for lunch and
downtime.
get it fixed. That you can. The emblasive one, I can't. I have to prep like a whole.
Yes.
But
But
what
that's the
age do you
thing.
go do that?
I mean,
Like,
so I do that a lot for acne scarring.
oh, cool.
Like
okay.
for deep acne scarring, there's nothing but those aggressive lasers. And people who really want to make a huge difference, those aggressive lasers are amazing. but there's downtime. The issue is that I think patients are so happy when they have it done, but I always want them to be realistic about expectations, about what to expect as you heal. I've had a number of people they're like, oh my God, the CO2 was the worst experience of my life, because they went to somebody who didn't tell them what to expect. They just thought they were going to be red for 2 days. And instead they come home with no skin on their face, looking like a burn victim. So like if you prep and you know what to expect, it's much easier to heal from.
What's the new laser that you have a new laser?
We have the Moxie.
There's the Moxie. It starts with an R.
Oh, the Renuvion.
Tell me about that. I'm curious.
Renuvion. So I always tell people, like, on the face is very vascular. It heals really quickly. So that's why, like, the face is the only place we can do the CO2 and erbium lasers.
Okay.
Like, you go anywhere else and you scar, you don't heal. Renuvion is for skin tightening other places on the body.
Like my stomach?
Yes. Anywhere, pretty much. And so when we talk about skin tightening without making an incision, all the devices use some form of energy and heat, some form of energy to produce heat. Mm-hmm. And what heat does is it will cause contraction of the tissues and then a little bit of heat-based damage that then the body goes into this healing response and starts to produce collagen. And then over the next 8 months, your body's responding and producing more collagen. So the less invasive or like non-excisional skin tightening, you get some immediate result, but you don't see the final results until you're around month 8 to 10.
You use that with lipo?
Mm-hmm.
They did a thing called like Skin Tight. I think it's just called.
There's Body Tight. So
nothing. It did nothing.
Yeah, that's the thing these devices.
After they did it while, I guess, during my surgery, they did it. Is that like when they did lipo and then they did the Skin Tight or something? And
yeah, and that's the thing is these energy devices, I've used the Body Tight, which uses radio frequency energy, but you have to apply enough energy in the right way to get, and on the right patient to get a good response. If I have somebody who comes in and they've got a lot of skin laxity and they want pretty much none, I'm like, this is not the right
you're being
procedure
realistic.
for you. Yeah, I mean, the last thing I want is for people to spend money and not be.
And it's not affordable.
Well, the Renuvion's great. I mean, it uses plasma energy, and basically, like, the plasma treats all of those connective tissue, fibrous little bands that connect the skin to the underlying tissue, and all the devices, surgical devices I've used, I feel like you get the best result.
I'm going to go in there. I'm going to do a call. I want to see if maybe I'm a candidate and just get to know the machine a little better.
And again, it's all about the right selection of the right patient.
Okay.
It's realistic expectations.
Sure.
If somebody wants, a lot of people come in for their arms, and if they're older, they've got a lot of fullness, they've got a lot of skin laxity, and they hold their arms and they're like, I want this. I'm like, that's a brachioplasty. Like, the only way you're going to get that result.
What's a brachioplasty?
It's like an arm lift. Where you get an incision from like there to there.
Oh, wow.
So
they cut off the fat, basically.
They cut off the skin. It's a big surgery with a big incision.
How many lipos can someone do?
Oh, there's not really a limitation. I mean, so we all have like a set amount of fat cells. Mm-hmm. And when you liposuction, fat cells are gone. And a lot of people say like, oh, well, it just moved. It didn't move, because fat is a live cell with a blood supply, so it's like fixed in that sort of layer underneath the skin. Mm-hmm. A lot of times people will like, oh, well, my lower abdomen that's where I carried it, so they do lipo there, but then they don't watch their diet, they don't work out, they gain weight everywhere else. But and when you gain weight, fat cells don't multiply; they just, all of them get bigger. Mm-hmm. So then that doesn't happen on the abdomen because you've already liposuctioned that. But like your flanks, those cells do get bigger. And then they're like, oh my God, the liposuction, all the fat moved to my flanks. And I'm like, no, it didn't. You've just gained weight there.
In those places instead now.
Right. Yeah. So you can remove a ton, but again, it's natural looking. Having 0% body fat, you see, it doesn't look good. It doesn't look healthy.
Right.
Like, as women, we also want to look natural. We want to look soft.
Yeah.
And feminine, you know, and it's when you have zero subcutaneous fat, it looks old. It looks
So, you know, I'm pretty honest about things I've gotten done for the most part. And I've done lipo twice. Once was in Miami, which was completely different of my experience than when I did it in Naples. I mean, completely different, where I thought the doctor in Naples wasn't doing it right. Well, that's not the way they did in Miami. And the one in Miami was so invasive because they do the surgery. Then they throw that Colombian like faja, like the whole
compression garment.
thing.
Oh, yeah.
And then they make you go to this lady that like
Massages everything.
bangs on your body and
bangs
presses.
presses to the point you're screaming.
Wow.
Okay, you're screaming. It like she pushes this
the fluid out of the
fluid out
Which-
of your
which is can be dangerous because that's number one. You're opening up
a wound.
wounds.
No, I'm bleeding
It's an
everywhere.
entry
She's
point for
pushing out of
infection.
she takes this is so graphic. If you don't want to listen to this, you might want to. They took like a Q-tip almost, and they open up your wound and then push fluid out, and you're screaming because you just had the surgery the day before, and they do it and they mold you. So I got used to that, right? And then and then I ate a bunch of donuts and things went really bad. And then 2 years.
Life happens.
And so then I went and did it again because that's what, you know, I'm thinking, oh, well, I'll just do it again. I'll do it again. I know.
It's okay. We are. Hey.
Yeah.
And then I went and did it in Naples, and it was very, very different. Where he was so classy, you know, it was just
Did
a
you have
very
drains
different.
or anything?
No drains. The faja wasn't the full thing; it was just like a thing, but there was no foam. They made you wear foam padding in Miami to make sure you never had creases, and they basically mold you like a doll, right? And then here it was more like about my health, and I was like, "Well, are you gonna, you know, drain?" And they're like, "No, we don't." So they never.
It is
drained
so.
me or
It's
anything.
very different. So in Miami, there are a lot of people who are from Brazil or
They were from
other-
Brazil.
and
They were.
They are. Surgery is
Is
different.
that healthy?
So again, you can increase infection
Oh my
with
goodness.
that type of drain opening up your incisions, getting the fluid out. Good, we like that. And it's a meld because yes, massage and everything and compression is a huge part. And a lot of plastic surgeons don't focus on that as much as they maybe should in the post-op period over on this coast. But
I couldn't find a good massagist. I couldn't. That's not even a word.
massage
A
therapist.
misogynist.
Yeah.
like, that's
I couldn't find a
male
misogynist. They're everywhere. Like that's for another
Walk outside on
episode.
the street, shit right there.
Everywhere. What the heck was I talking about?
A masseuse. You
It's
were
called
massage therapist,
lymphatic.
lymphatic drainage.
You
Could
lift
not
that, yeah.
find a good one.
Yeah.
They would just go ahead and start tickling my arms and my ears. I said,
No,
"Lady,
the
I don't need that."
So
Yeah.
this is there's
Crazy.
there is traditional lymphatic massage, and then there's post lipo lymphatic massage. The traditional lymphatic massage, I went for that once because I'm like, I was like, did you do anything? It's this weird like tap 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 tap, like you tap on these different focal points, and I'm like, what is she doing?
I don't want
Yeah,
that.
what is that going to
I'm
do?
like, she's like tap tap tap. Don't you feel?
You want to
your
piss me off? Start
sinus-
tapping me on my face.
Sinus is draining, and I'm like.
Her own kid
Paying
will, like, do that to
$180
annoy you,
for
yeah.
this. I'm like, what is
My
this?
kid will do it at home to
So
drive me crazy.
the post lipo massage is different, and I have a girl. She's my general massage
She's
therapist.
okay.
But I tell people, I'm like, get ready for some discomfort,
No, and that's fine. I want to feel that.
which is good. But I have noticed that on this coast, like after liposuction, they give you like a garment, and they don't really talk to you as much about because there's like level stage 1 through like stage 10 of compression. And like each body's different, and then once that swelling,
I'm gonna go. I'm gonna have a consultation with you guys just to go. There's something funky going on. Like, just I want to talk to you guys. I want to wear a tiny bikini and feel confident again. And for the moms that are listening, like that's not important. It is important to me. I want to feel
when you take
hot again.
When I take
you know,
like the kids out to the beach, you want to feel comfortable, right?
Yeah.
And like I remember after both kids, and I just like having loose skin and feeling like I
Right.
just felt
It's
uncomfortable running after my kids, and I was like. And then you see some mom over there who's all fit, and she probably like
Amazing.
put her pre-pregnancy jeans on,
Yeah.
going home
away.
from the hospital.
Yeah, exactly.
And I'm
hard.
like,
It's
okay, fine, but that's not the majority of people.
No. even though it feels like it sometimes.
I know. It really, well, Instagram doesn't help. You see
It
this
definitely
and you're
does.
like, she
None
just
of that.
had a
That
kid.
is, well, I love having the internet and the access, but it is also really given people unrealistic goals.
Sure.
You know, like my daughter, she's going to be 17 this week, and you know, they see these people on Instagram and they're like, I have to look like that and I have to be this beautiful, and I am like, that's not realistic. Like, you're beautiful. You girls
And that's
need
so crazy,
to focus.
having a plastic surgeon
I was
facial.
going to ask that question
Gosh.
actually.
Oh, no.
I was very curious, having a 17-year-old, what it's like to be a plastic surgeon mom, and if she asks questions like if there's
She
she
does,
wants.
but
to,
I have always said, you know, I've had moms come in and say, "Oh, can my 16-year-old, can she do lip filler and this that?" And I'm like, no, our daughters, we need to have them love themselves,
Yes.
and have confidence in them, like inside.
Right.
You do not want to teach your kids to focus on, especially the young girls, focus all externally. I always say there are 3 things guaranteed in life: death, paying taxes, and getting older.
Right.
And if you put all of your self-worth in your looks, you're going to be disappointed.
Gosh,
Right.
You know,
so
we
good.
can
Love that.
absolutely do things to help as we get older, but you want them to have, you know, confidence inside
Right.
first. So, you know, my daughter, I mean, she's drop dead gorgeous anyway, but she's like, oh, wow, she's great. She does all the good skincare. I love it. They're all hyped up on sunscreen. Like, they're not going to be like I was in Indiana when I was like see-through, and going to a tanning bed.
Yeah. It's so big now, skincare for that age and younger.
But it's
Talking
again like,
about skincare.
but it's seeing
No, by the way, I didn't get paid for any of this. I want to let you know, I really do, by the way. I absolutely love your skincare products at
good.
Azul.
I actually had some of them
And
and
I
they're
can tell the
phenomenal.
difference when I run out of something. I'm like, I'm okay. No, I'm not okay.
Botanical cleanser is
So,
my favorite
incredible
thing in the world. Yep.
I'm almost out. I had the big one, the ultra peptide eye cream. I'm running out. I ran out of the ferulic acid. I need to go get some this week.
For you, don't worry.
I'm not telling. When I tell you, I can tell a difference in my face, and it's if not better than SkinCeuticals. No offense, but they're great. But this is
It's also
Your holy
going
grail right now.
right.
Oh,
going
it's
to an
medical grade.
esthetician who can tell you like your skin type
Yeah.
and tell you like these are the things you should use, because too, people at our age, I mean, we want to do things that are preventative. I mean, I have women who come in at 60, 70, never done anything.
that's brutal.
And they're
they
like,
want it now.
can you fix all this with like a little Botox? And I'm like,
What are you talking? I can't imagine.
Where have you been for the
you know,
last
and I'm
40
like,
years?
I love my patients who
You
are
have
like
to tell
doing
people no
maintenance.
sometimes.
Oh yeah. Oh,
And
all
do they
the
get
time.
upset?
No.
Or they're thankful?
No, because it takes a lot of guts to make an appointment about a cosmetic surgery. Like you're going in and you are being
So vulnerable.
Yes, very
saying
much
like
so.
this bothers me. And so I always like to make people feel comfortable. And I'm like, oh, I understand what you want, but it's my job. It's my job to tell you what it will require to get you that result. And these half things or like these things might help certain things, but they will never do this. It's because you don't want to promise something and then somebody spends thousands of dollars on a non-invasive procedure and then they're like
They didn't get what they
nothing,
want,
they're
or
not
the
happy.
expectation. Yeah.
Well, I can't. So, so you're a mom, and so I assume like when your daughter was in high school and your son and they're looking at you and you're done up and they know that you're a plastic surgeon, was there some kind of mean mom energy or did they just want
God, no.
information? Okay.
Oh, yeah.
They wanted it all done.
Mm-hmm. No,
Okay,
no, I
that's
mean,
great.
they just, I'm mom. You know, it's like when I get done with work, I'm mom.
Okay,
like,
great.
When I'm out, like I'm not Dr. E, I'm Allie, I'm mom.
Mm-hmm.
And it's funny. One time my son, he was a lot younger, and we were watching American Idol and on the big screen. And of course, like this lady is there and she's raising her forehead. He's like 7 or 8. And he goes, Mom, that lady needs Botox. And I was like, yes, she does.
You're right, son. Good job.
Yes, she does. You know, but again, I've done my dad's surgery. I've done my in-laws
No
surgery.
kidding.
Really?
Yeah, I don't trust anybody else.
Wow.
So, but like,
That's interesting. Sometimes it's the opposite where they can't,
right.
and you could.
I don't when I'm in the OR, like it's this. But again,
That's so
I
cool.
don't trust anybody else. So I'm like, how am I going to do my own blepharoplasty? How am I going to...
Wow.
Do you do facelifts? Mm-hmm. You do? Okay, I just know who I'm going to go to. So I'm just okay. Not when it's time. I definitely do.
Is there ever a time with that you have a client that you feel like you need to say no or no more?
Yes.
You say?
Oh yeah. Yes. I mean, there are people that they'll come in for their fourth consult for a fourth.
What do they have to sign? A waiver
facelift.
or anything? Or at that point?
Yeah, you know, I mean, yes. I mean, again, if it's a special situation, you have to talk about realistic expectations. And obviously there are always risks. You know, when you sign a consent, a lot of people don't read the fine print of everything. But in medical, you have to list like every possibility, even if it's just been reported in a journal and the incidence of it's like 0.00000%, you know.
Exactly.
But you have to put it on there. But it's my job to tell people what is going to look good, you know, how to get them their goal. And also, I mean, I've had people who they want their eyebrows raised in the middle of their forehead. And I'm like, I'll be honest, like, I'm not going to do that. That
want to be a
doesn't
fly on that
look
wall.
good. You know, here, what about this? You know, again, one of the things, you want to look natural. People come in for their fourth facelift. And I'm like, you've got less skin
Why do
than
they have to
I
do so many facelifts?
Well, okay. There's when you say facelift, there's a bunch of different kinds.
Okay.
So there's, you know, people, I had a mini lift and I see the incision from like the whole face and neck lift. And I'm like, oh.
Did Lindsay Lohan have a
That was my
facelift?
question earlier.
She says she didn't.
I don't think so. I think she did aggressive laser.
I was going to ask you this when we were talking about the skin.
I could see that.
Because
I could
she
definitely
has no
see that.
freckles and sunspots anymore.
yes.
And I'm dying to know what that is.
Laser.
She looks stunning.
That's
Stunning.
aggressive laser. Probably
that done.
exosomes.
So that's why she can get away saying, I never did any kind of invasive
but
surgery.
I was curious because her skin is flawless now.
I
She's
saw
glass.
recently, I'm like, what is this resurgence? Like,
That's
I remember
what I
her from like, you know, the Freaky Friday or the Parent Trap and all those things. And she was looking rough for a while. And she's like stunning.
Oh my gosh, she's incredible.
Stunning. But again, it's doing things so things look natural.
Right. What about what do we think about what Kris Jenner's had done? Because she looks amazing.
Oh, she looks great.
She looks amazing.
She probably had a
natural
facelift
now.
and a little bit of fat grafting.
Fat grafting.
Oh, fat grafting is one of my favorite things in the world to do.
What is this?
Okay.
So like if this goes in
So
a little bit.
one of the things as we get older, we lose facial fat.
Okay.
You know, and we have specific fat pads in our face and we lose those. And once you lose that, things sort of deflate and things just fall. And that's why like mild, we can replace it with fillers, you know, but fat is what we lose. So it's almost like you have BBLs, the Brazilian butt lift, because it's the same thing, but on your face.
Where does the fat come from?
Wherever we want to take it.
Interesting.
You know, there are areas that
Okay.
are better, but a lot of times, you know, the abdomen, you can do inner thigh. I personally harvest the fat with a cannula by hand. Like I don't use the lipo machine because I want it to be very delicate. But because fat's a live cell with the blood supply.
Unbelievable.
So with the cannula, you don't get any incisions, but with a teeny little cannula, you go in and you feather the fat cells back into where you used to have fat pads. And those cells develop a blood supply so that they're there. So they last years.
That was my next question.
Instead of fillers that you have to keep
of course.
up.
Yeah.
But also fat has tons of growth factors and stem cells in it. And people's skin always looks better.
Do you also do nose jobs?
I don't.
Okay.
I do liquid rhinoplasties.
Oh,
sounds
I've seen
amazing.
those. Yeah.
It's
Yeah.
almost like a not Botox, but kind of like a needle in the nose. That they
Oh
need
yeah,
to fix it,
and
right?
there are some that people will leave my office crying
Because
because they're so happy. And I've had a lot of people who have had nose jobs before, and they've had multiple, and they've got scar tissue, and surgeons are like, "I won't touch that," you know, just because risks.
it's too botched at that point. Yeah.
You can even out things so well with
I've
it,
seen
but again,
phenomenal
you have to
results.
know the anatomy. And did I learn how to do a rhinoplasty? Yes, but that is a very nuanced procedure that if you go get a rhinoplasty, you want somebody who does that for like that's what they do. They're the specialist.
It's like goat and turkey, right? Everyone seems to fly to Turkey for nose jobs.
And
right?
hair and hair
You have
transplants.
such a great nose too.
Oh,
It's like-
thanks.
There are all little tweaks with Botox that you can do to slim your nose too.
with the liquid.
Well, you can make your nose look slimmer with the liquid rhinoplasty, but you can also place Botox to because we've got this muscle that flares, and if you Botox it, it can.
Oh, that's interesting.
Do you do that?
Mm-hmm.
Oh, we have a meeting. It's a long meeting. Is there anything else before? I know you've got a busy day. Anything else that you think that moms should know, and maybe myths or anything?
Take care of yourself. You know, I mean, it's so hard. Because people are like, oh, well, I don't work. I'm just a mom. I'm like, okay.
Just a mom.
Yeah,
Like,
just a mom.
That's like, I'm sorry. When you have kids, you lose all freedom. Like, and that is like the hardest job in the world.
Yeah.
And people don't get enough I don't think people get enough credit. And there are so many things that women we worry about, and no offense, but a lot of dads wouldn't even cross their mind. And so we have so much on our plate that people need to take time for themselves. It might be an hour, go get a massage, go get a hydrofacial or something, because we feel better. we feel better when we look pretty.
Yeah.
And like make it a priority to set aside. You don't have to do crazy things, but set aside some time for yourself.
Absolutely.
Because your mental health is so
That's
worth it.
literally the premise of our club too.
Yeah.
And I think that a lot of times when we launch in different cities, we get hit with some really ugly comments where, like bimbos, gold diggers, bonbon eating. And I'm like, even when I was getting ready to come here today, I was laughing. I was like, if people really knew what I look like and what my weekend was really like in comparison to what they see on
You're
camera
like, I've
or
got
at the
pink
events.
in my hair.
I looked crazy. It's not, I looked.
For people to judge,
based on the name of the club.
Well,
we put the posh in motherhood because guess what? Motherhood is not posh.
It's not
It's not. It's the complete opposite. And without it, it's hard. So it's so nice to just have a do something nice.
A reason to dress up.
I
Do your
agree.
hair, makeup,
And then,
get dressed.
meet different other women, and you can have groups like, or hey, maybe we get this person's babysitter can watch these kids, and we
can do it all the time. We've got our
something
posh
where
nanny
it's just
and
giving, and it's just again celebrating
just conversations
moms
like
and
this.
women,
Yeah.
and then just supporting each other.
Thank you so much for coming.
Of course.
Thank you.
is so great.
I love you being here. If women want to reach you, you work at which location?
I am
Azul?
at the Fort Myers, Bonita, and the Cape.
Okay, great.
But they can call online.
So just call Azul Cosmetic Surgery and Medical Spa. Say that they want to book an appointment with you, with Dr. Yee, a
and
consultation.
you can talk about whatever.
Great. Okay.
Yeah, and that's the thing. No judgment. Again, it's hard sometimes going in and
I feel
admitting.
more comfortable going to someone that understands my anatomy and what I've been through
And
and
a
what
lot of
I've
times,
done.
like as a female, like I get it. I remember my
me to go
training.
to, like, this-
In training, I was trained by all guys, and a woman's like, well, this bothers me because of my mascara and my eyeshadow, and then this, and of course my fellowship directors are like, oh, it looks fine. You look fine. And I'm like,
I don't want to look fine.
I'm like, that's not what she was saying. Like these things are bothering her. And there are things that we can do that it's natural. Look,
That's just like a relationship, though. When you tell a guy something and they're like, "Yeah, but you're fine," and you're like, "I'm telling you,
I'm not doing this
feel.
for you."
You're not listening.
You're not
right,
listening.
This is how I feel. Like that's not an
Well,
option.
men are black
it's not
and white, though.
Yeah,
they're
very
they're,
much.
they're
But also
black
when
and
you
white.
say like I feel this, they can't say that's not true. When you're having an argument,
Yeah.
like you can't say you're this, you're that. I say I feel like this. They can't say no, you don't. So I always like if I ever want to get a point across, I'm like, this is how you made me feel.
Oh, I like that. I like
That's
that.
very true. That's good. I like that.
I'm gonna take.
This is how
I'm
it
gonna.
made me feel.
Because then they'll be like, I did not do that. And you're like, really?
The
Because
best
they're
is
my
like,
feeling.
I'm sorry
But you
I
did.
made you feel, I'm sorry you feel that way. I'm like, no, that's not an apology.
She's been married how 19,
We've
20
been
years
together
too?
for 19 years.
Yeah.
Married for 13, 14, since 2012.
Yeah.
But together 19
been a
years.
minute.
Yeah. Yeah.
Well,
Well, I'm happy to come back and talk about other stuff.
oh gosh, would it be nice if we maybe even ask some of the moms to put questions together
gosh,
for
yeah.
us and we can read it? Say, hey, we're going technically not live, but we're going live. We're recording today. Send us some questions. Let us know. Let's do a Q&A. And I think it'd be really cool. Or even have people call in.
Yeah, absolutely.
Okay, we'd love that.
Great
And I
idea.
think that women, again, no offense, but being that you are a woman, I think that they would be more comfortable
Sure.
bring up certain topics and talking about them with you.
Labiaplasties?
Yes.
Yeah, I mean, they'd want to talk about it. Let's talk about it.
Right.
So let's talk about the labia. Let's do it.
Let's talk about labia, ladies.
Well, it's
Whatever,
it's a very common thing, but to bring it up to a man and be like, I'm bothered by this. Like
He might see him all day, but
Right.
he doesn't have one.
Right.
It's very different. It's so hard.
and it's real. I mean, stuff changes down there. So it's like, and you can do things about it.
That's so cool. Thank you again.
Yeah,
Thank you so
absolutely.
much.
So nice to meet you.
On to
So
the
glad
labia.
you were here. Oh my God.
I went there.
Thank you, Diana. That's great.
I did. I went late.